is we're going to be looking at the patterns involving the trunk. So specifically, we're going to look at the scapula and the pelvis. So remember, with PNF, we have patterns of movement. So we're going to start up with the scapula. But the first thing that we want to do before we look at the movement at the scapula, or we begin to treat at the scapula, we need to position our patients. We're always going to start with patient position and alignment first. So I have my patient laying on her left side. We're going to be looking at her right scapula, and you'll see that while she may be somewhat comfortable, she's not very anatomically aligned. So let's start with alignment. So the first thing I'm going to do is just look at her hip position and her spine position. So I'm just going to kind of roll her this way a little bit. I think I'm going to get an extra pillow so that we can make her a little bit more comfortable at the legs. So I'm just going to put a pillow there. I like to keep the knees slightly flexed up for stability. And then what we need to do is we need to address the spinal alignment. And specifically looking that we keep the spine straight and looking at the neck. And if we look at the neck of our patient right now, we'll see that she's actually in some side bending. And what we want is that to be in neutral. So we either need to add another pillow in to bring her cervical spine in better alignment, or we can use a towel roll. So either, let's see if we can accomplish it with the towel. So what I'm going to do is I'm just going to come and put a towel roll at that area. And I'm going to have you just bring your head back, tuck your chin in. Can you slide back towards me with your whole body, especially your shoulder? Good. Okay, so it does take a couple minutes to get ourselves into alignment, and tuck the chin. And so now if we look at her spine, we have a little bit better position. One other place that I like to look at, especially on a woman, is the spine in the lumbar area. And especially since some women have bigger hips, what we can have is a little bit of a dip through the lumbar spine. And you can solve that problem. And that telefold, if I can get my patient to lift up, I'm going to stick this in through her waist. Is that okay? Mm-hmm. And again, that will make her a little straighter. Now, Erica actually doesn't really need the towel roll. So I'm going to pull that back out. But just to show you that some patients may need that. But she looks fairly straight as it is. I like them to be fairly comfortable on the down shoulder. What we're going to be working on is the top shoulder. Okay. So I'm ready to now address the shoulder. I've got my patient positioned. The next thing I'm going to worry about is my position. So I need to be in a position where I can take a hold of the segment, which is going to be the scapula and shoulder girdle. I prefer to stand somewhat in that diagonal. The first diagonal that we're going to look at from the PNF perspective at the scapula is the diagonal of anterior elevation and posterior depression. Anterior elevation and posterior depression. Now you'll notice that that diagonal sits right about here. If we think about a clock, where that would be 12 o'clock and this would be 6 o'clock, then the pattern sits at 1 o'clock to 7 o'clock for anterior elevation and posterior depression in this position. The other diagonal that we will look at in a few moments will be this diagonal pattern into posterior elevation and anterior depression. And if we use that clock example, that will be 11 o'clock to 5 o'clock. So it's a fairly narrow diagonal. It's not 3 to 6. Okay? So narrow diagonal. So the first thing I'm going to do is position myself in that diagonal. So this is the diagonal we're going to look at, anterior elevation, posterior depression. Okay, coming from 1 o'clock to 7. I'm going to go ahead and position my hips so that they also fall within that diagonal. So I will be standing fairly close to her hips. Now, you'll notice the scapula, if we're going to do this pattern, the first thing I need to do is also align the scapula onto the thorax. So what I'm going to do is I'm going to just grab a hold of the arm, and then I'm going to grab a hold of the scapula. I'm going to bring the whole segment up into the loose pack position. And basically, I like to just get the patient to relax. I'll just kind of roll it around a little bit, and the patient's just relaxing. And then I'm going to just do what we call setting the scapula. Setting the scapula. So I'm putting the scapula into its normal alignment on the rib cage. Okay? So if you can kind of see our scapula with our inferior border and the top of the scapula and the medial border and our lateral border. Okay? So remember, she started here, so she was too abducted. So I'm just basically, again, loose pack position. I'm just taking that scapula and I approximate it by just setting it, putting it back onto the rib cage. Now, with her in good alignment, I can now check or assess the range of motion at the scapula. I like to just let the arm slightly relax here, and you can capture it with your forearm. And I'm just going to, again, grossly grab at the scapula and the shoulder complex with my elbow kind of hugging in, and I'm just going to now take, my patient's going to relax, so just relax, patient. I'm just going to take the whole segment and bring it up into that anterior elevation position. Okay, up again towards that 1 o'clock position. And when I get up there, I'm just going to go ahead and give a little overpressure to feel the end feel. It should feel nice and springy. Then I'm going to take the whole segment, bring it down into posterior depression, and again, going to feel my end feel there. So this is giving me an idea of what her range of motion is in that pattern of movement. Now let's look at that pattern of movement. That pattern of movement of anterior elevation, if we look at the scapula, what is the scapula doing during anterior elevation? Well, it's elevating, it's also abducting, and it's upwardly rotating. So those are our three components into anterior elevation. As we go into posterior depression, you'll see that the scapula is depressing, going into some adduction with downward rotation. So we have three components of movement. So I can just assess how well her shoulder is moving in that diagonal pattern, anterior elevation, posterior depression. I get an idea of how much range she has, and then again I get an idea of what that end feel is on both sides. Okay, so that's our assessment of range of motion. Now, this idea of taking her through passively, we can introduce our first PNF technique, which is called rhythmic initiation. Rhythmic initiation is just rhythmically taking her through the pattern and teaching her the pattern. We start out passively, so she just gets a sense. So this is how your shoulder is going to move. It's going to come up here to down here, up here to down here. Notice as I take her through rhythmic initiation, I am getting all three of those components, and especially that rotation, upward rotation, downward rotation, and I'm doing that with my hand. It's not just an up-down movement this way. It's an up and over, down, okay? So I start out passively, and then I ask my patient to gently help me do the motion. So can you help me, Erica? We're just going to bring this up here and down here. Bring it up here and down here. I keep my verbal commands very simple. Let her feel the motion. Rhythmic initiation, passive to active assistive motion. Now, let's look at anterior elevation, and let's look at now adding in some resistance to that pattern. Let's be pure to just doing anterior elevation. So again, I'm going to check my alignment, and actually I'm going to have you bend your knees up a little bit. Okay, and tuck your tummy. Okay, so what I noticed is she was getting a little extended in her spine, so I always need to make sure that I'm checking back to alignment. First thing I'm going to do, again, set the scapula. I'm going to now start her at the end of the range of motion, which is into posterior depression, because we're going to be working on anterior elevation. Now I'm going to be very specific with my hand placement if I'm going to add resistance. So our manual contact now is going to be right up here onto the top of the shoulder, right up on the chromium. So I'm going to take both hands. Okay, now her shoulder is not really big, so I'm just going to put one hand over the other. I'm using a lumbrical grip. So I come onto the shoulder, contract my lumbricals. Okay? And then what I'm going to ask my patient to do is to just pull up. And again, I'm looking that she goes through that whole pattern of movement into anterior elevation and relax. So let's look at that again. So again, I've got her scapula set, bring her down into the end range, which would be into posterior depression. My hands or my manual contacts come right to the top, just slightly forward, hand over hand, and I'm just going to now ask her to pull up. Make sure she's getting through the whole range. Notice my resistance goes up and over the curve. So remember that we get that rotational component. So I need to make sure that I'm resisting that. I'm resisting that through my arms and through my center of gravity. Let's watch it again. And let's pull up. Pull, 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 pull. Good. And relax. Now, you also notice I'm going to add one other thing to this pattern, and that's called an initial quick stretch. So I'm going to add a little bit of a stretch at the end of the range of motion to activate the muscle. So again, we start with setting the scapula, bring her down into N range, put my hands, manual contact, top of the shoulder, and now what you're going to notice, I'm just going to give it a little hug, just a little stretch, further elongating the pattern into shoulder depression, adduction with downward rotation. So that's what my stretch is going. I'm pushing that way. We're sinking down, hugging into it, and then immediately following with resistance as she pulls up. So I have to make sure that my verbal command is timed appropriately. So I'm going to tell her to pull up as I apply the quick stretch. So it will look like this. And pull up, pull, 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 pull. Good, and relax. So watch that quick stretch. And pull up. Good. The quick stretch will allow you to get a little stronger contraction. Okay, so that's looking at anterior elevation of the scapula. Now let's look at posterior depression of the scapula and resisting that pattern. So for us to do this, again, we're always going to start with alignment and setting the scapula. Now I'm going to bring her to the end of the range of motion, which will be into anterior elevation. So we're up into elevation, upward rotation with abduction. And what we're going to now do is resist her coming down into posterior depression. This one's a little harder to resist. And where we want to be is we need to find that inferior border of the scapula. And what we're going to do is we're going to scoop some tissue up onto the bottom of the inferior border of the scapula. The remainder of our fingers, again, with our lumbrical grip, will just help approximate the scapula. Okay? So again, we're going to kind of scoop in to that inferior border of the scapula. My other hand will now slide to the lateral part of the humerus here. Okay? So that's our manual contacts for posterior depression. Let me just take that back. So again, we set the scapula, bring her to N range, get my hands in position. And again, now I'm going to ask my patient to push down and push down, push, 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 and relax. And again, notice the quick stretch. So I'm going to hug or just further stretch that patient into elevation, abduction, and upward rotation. And push back. Now what I want you to notice with my hand position is, again, I am staying in that diagonal. My forearms are staying in the diagonal. Notice how my elbow has to drop to get that rotation at the scapula. So watch for that as I resist again. And push down. There. See that last bit of rotation. The whole time, remember, I am resisting by pushing in that opposite direction. So I'm pushing up this way as my patient is pushing down. Anterior elevation, posterior depression of the scapula. So we've looked at doing a quick stretch, and we've looked at then following resistance with that. Okay, let's also now, while we're working on anterior elevation and posterior depression, let's look at a couple other techniques that we can do in this pattern. Well, we've looked at just doing them individually. Let's look at perhaps doing them in a reciprocal manner. Maybe Maybe what you want to do is have my patient go from one direction to the other. So if you have a patient that's having difficulty reciprocating between agonists and antagonists, this may be a good technique for you to use. So what we're going to do now is we're going to resist it in both directions. That's going to involve a hand change. So again, we're going to start, as we did, patient position, therapist position, manual contacts. First thing I'm going to do at the scapula, set that scapula. And I'm going to start at one end of the range. Let's choose to start in posterior depression. So we'll start with anterior elevation. So if you remember, our manual contacts will be here at the top of the shoulder, just slightly forward. Okay. And then again, we'll do this gently. I'm just going to ask my patient to pull up. Pull. Good. Now hold it there. I'm going to ask for the hold so that I can change my hand, and I'm now going to come and change to that same posterior depression position. And as soon as this hand comes in, she's going to push down and push down. Hold it. Then I can change my hands. Pull up, hold it, and push down. Push, push, push. Hold it there. Hold it there. Pull up, hold it, and push down. Pull up, hold it, push down. Hold it, pull up, hold it, and push down. Push, good, hold it there. Pull up, push down. Pull up, push down. Pull up, push down. Now what I did there is I got rid of the hold. So as you get more adept at the pattern, or if your patient is doing it fairly well, you may be able to switch your hands a little bit quicker without asking for the hold at the end of the range. The key is, though, they have to stay within the pattern. Okay, if they begin to pull out of the pattern, you probably want to go back to adding that hold in again. So let me just show you that one more time. So starting her here, so it's pull up, she comes through full range, she holds it, so she's still pulling up, I'm still pulling down. This hand comes, I'm going to give her a quick stretch and ask her to push down the other way. This hand catches up, hold it. This hand comes off, and as soon as this hand comes onto the shoulder, I'm going to give her a quick stretch and pull up. The other hand catches up. Hold it there, good, and push down. Hold it there and pull up, hold it, and push down. So this is reversals of antagonists, working in this position into anterior elevation and posterior depression of the scapula. Okay, let's look at our other diagonal pattern, which, remember, is this one, right? This was the one that went from 11 o'clock to 5 o'clock. So now we have posterior elevation and anterior depression. Well, remember when we did this pattern, it was important for me to be in that diagonal. Well, now it's going to be important for me to be in this diagonal. So I can't stand here and be in the diagonal. So I'm going to have to change my position, okay? My patient is going to stay where she's at, and I'm just going to choose to change to the position up here at the head. That's now going to put me into that pattern. Now, what you may find a little bit easier is to have your patient scoot up closer to the edge of the table. So I'm going to, Erica, have you scoot up just a smidge towards me. Okay, and now as you do that, unfortunately, you have to check your alignment again because you might have messed everything up. So let's, and just relax, and let's see how we're doing. So we're looking at our cervical spine area. We're looking at our lumbar spine, making sure that that is fairly straight. Okay. And you comfortable?
Yes.
Okay. So again, now what I'm going to do is I'm actually going to bring the humerus in a slightly forward position. And now the first thing I'm going to do is what? Oh, set the scapula, right? So we always need to position that first. So again, gross hand placement on the scapula and on the shoulder girdle. And I'm basically just going to bring her up into loose pack position. And now I'm going to take that scapula, and again, I'm setting it. So I'm putting it in normal alignment on the rib cage. Now let's look at the movement of her scapula. What's her range of motion going into anterior depression and posterior elevation? So I'm going to just choose to put one hand on each side of the trunk. And what we're going to look for is this is the motion into anterior depression. So if we look at anterior depression, what is it that the scapula is doing? See if you can analyze what the scapula is doing. As we come into posterior elevation, what is that scapula doing? Okay, obviously it's elevating, okay, and it is now upwardly rotating and abducting. As we go down, it is depressing with adduction with downward rotation. Okay, so just anterior depression, posterior elevation. So again, I'm starting with rhythmic initiation, which is to teach the patient the movement pattern, as well as for you to assess the range of motion and end feels of the scapula. So here's the movement that I'm looking for. So Eric, I just want you to feel that motion to here. So we're coming from here, and then we've got this motion back here. And again, they should feel springy in a normal scapula. So now let's look at, if I want to move on to resisting the pattern, let's look at posterior elevation first. So for posterior elevation, I'm going to start her down in anterior depression, and that's where I've got her. Hand position here, or manual contact, very specific. We're going to, again, be up on the top of the shoulder, about at the acromion, but now we're going to be slightly to the posterior aspect, again, using my lumbrical grip. Okay, so notice that I set her scapula, brought her down there, and then I can hold the set of the scapula, okay, bringing both hands to the top with your lumbrical grip, and then again ask her to gently push up and back into me and relax. And I'm just going to tuck your tummy in just a smidge. There we go. And push up. Good. So there is posterior elevation with resistance. Again, notice my quick stretch as I do that, do the pattern. Again, just going to further elongate her into that pattern. Not real happy with my set here, so let me redo that. You okay? And push up. There's the quick stretch followed by resistance. Again, notice the elbows have to drop down to get that rotational aspect of this pattern. That's posterior elevation. Now let's look at coming into anterior depression, okay? So again, we're going to start with the set of the scapula. We're going to start at end range, which is posterior elevation. And now what we're going to look at is coming down this way. Now we have two choices for hand position. Let me show you the standard hand position first. This is a scapula pattern, so we want to be on the scapula. So I'm going to have Erica just raise her arm up for you so that you can see. Okay, we will not do this as we do the pattern, but where I want to resist is I want a hand on the scapula. It's a scapula pattern. You want a hand on the scapula. So this hand is going to, again, come right onto the trunk and onto the scapula, and then I'm going to contract my lumbricals. My other hand is going to come anteriorly. Again, it's going to come on the trunk. So if you can see, I'm right here. Now, I'm not up into the armpit, but I'm just slightly below. Okay, but I'm on the trunk. I'm not on the arm itself. I'm on the trunk. And you can put your arm down. Okay, so basically I'm hugging around the trunk from the anterior and posterior side. Notice again that I am in the diagonal, okay, in that 5 o'clock to 11 o'clock position. We're bringing her back into the end range of posterior elevation. And then what I'm going to do is I'm just going to sink back, give that little hug, give that quick stretch, and I'm going to ask her to pull down and relax. Set my scapula and pull down. Good. Relax. Pull down. Okay, so that is one hand position. What you want to watch for with this hand position is sometimes this front hand, due to the nature of where you're at over musculature, is you can often activate the pec major muscle. When you do that, what will happen is your patient will actually pull forward in this direction. Do you think you can try to do that for me? And pull. So they do that. Let's try that one more time. And pull down. So you can see she's actually rolling the trunk forward, and instead of getting a movement this way, she's getting a movement that way, which is not the movement I want. So I might go back to just saying, no, I want you to pull here, but it could be that I'm stimulating the pecs. So an alternate hand position looks like this. We're going to keep our hand the same on the scapula. It's a scapula pattern. I have to have a hand on the scapula. Start back up here and relax. Start back up here in posterior elevation. But instead of putting this hand on the anterior chest wall, I'm going to take it, I'm going to actually put it down here at the elbow. And so I'm going to resist with both hands. Just be cautious not to over-resist with this hand at the elbow. So you start her back up in here into posterior elevation. Again, I'm going to give the quick stretch. Quick stretch should really be coming from your scapula hand. And then I'm going to ask her to pull down and pull down. Good, and relax. And pull down. Okay? And pull down. So 2 hand placements for for anterior depression. And pull down. Now what you want to watch is, again, my hand placement should be here. Try not to lay right up on top of their arm so that you're not giving them too much tactile stimulation so that they don't end up picking the arm up. All right, so now we've looked at anterior depression, posterior elevation. We've looked at them individually. Let's do how we did anterior elevation, posterior depression. Let's look at a reversal where we're going to put the two together, reversal of antagonists. We're going to actually pull into anterior depression and then go right into posterior elevation. So that's going to look like this. So what do we start with? Always look at alignment. Start by setting the scapula. We start at one end of the range. Let's start her down into anterior depression. If we do that, that means we're going to be resisting posterior elevation first. So my manual contact. Top of the shoulder slightly posterior. And push up. Get her through full range. Hold. And then again, my hand is going to come on and pull down. Okay, and I'm choosing the alternate position here. Sorry, hold. Then I'm going to just switch my hands and push up. Hold it there, good, and pull down. There's the other hand position. Hold it there and push up, good. Hold it there and pull down. Hold it there, push up, push, 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 good, hold. Pull down. Okay, so you have your choice. Push up, hold it there, pull down. Okay, try to keep your thumbs up. I noticed I had my thumbs down on her humerus. Again, when they begin to pull, you want to make sure you have no contact on this part. So we're keeping onto the trunk. Okay, let me just show you that one more time to make sure that you saw that clearly. And pull down, hold it, and push up. Good, hold it, pull down. Good. Okay. Okay, so let's come back to the scapula again, and we're going to introduce a couple other techniques that we can do here. I'm coming back to the anterior elevation posterior depression pattern. So again, I'm going to stand down here by her hips. I want to introduce a couple other techniques. So let's first, again, we are checking the alignment of our patient, okay, and she looks pretty good. I'm going to be in the diagonal, so my patient therapist position. And now again, the first thing I'm going to do is get my patient to relax. I'm just going to set that scapula, and again, just to remember, anterior elevation, posterior depression. So now let's look at anterior elevation, and let's look at the technique that's called repeated stretch through the range. Repeated stretch through the range. So remember that we've introduced a quick stretch at the beginning of the range to activate the muscles and get a stronger contraction. What you might find is that your patient may peter out, get a little weak through, or they're just not giving you a full effort. So we can use the repeated quick stretch during the pattern, okay? So this works real well for the weaker patient or the patient that begins to pull out of the pattern. And so you would apply that quick stretch just before they would come out of the pattern. So let's look at what that would look like. So I'm setting the scapula. We're going to look at anterior elevation. So I'm going to start into posterior depression. My hand placement, again, manual contact on the top of the shoulder, slightly anterior, okay? And so what I'm going to do is introduce a quick stretch. So it's pull up and pull up and pull up. Okay, so I've given 3 quick stretches through the range. Repeated quick stretch through the range. Let's look at that again. And pull up, pull, pull. Now, notice the tone of my voice. Our verbal commands are very important. They need to be timed appropriately, and they need to be facilitatory for the patient to pull. So I want to talk in a little bit louder voice as I get her to pull. And pull up, pull, okay? That will tend to give you a stronger contraction. There I did 2 quick stretches. So it will depend on how much range of motion you have on how many quick stretches you get. What you don't want to do is to introduce so many quick stretches that she can't get an appropriate contraction, which would look like this. Don't pull super hard. And pull up, pull up, pull up, pull up, pull. Okay, if you introduce too many quick stretches, then she really can't build up enough power through the range of motion. So you need to think about how many quick stretches that you can get in. On her scapula, 3 seems to be a pretty good number. And pull up, pull up, pull up. Good. Okay, nice technique. Another technique we can introduce here is traction. Traction is an excellent technique to use on any of the patterns, and it's very effective at the scapula. And what traction is while you are resisting the pattern, we're now also going to apply traction to the part. So let me see if I can explain that for you. So if we start here in posterior depression, our resistance, if you remember, as she pulls through the range of anterior elevation, is coming from my arms or into my body, into my center of gravity. Now with traction, what I want to do is to traction the part in an upward direction. So I'm not only going to be resisting by leaning back, but I'm also going to be applying a traction force in the upward direction to the pattern. So if you can look at my thumbs, as she resists, the traction will be in this direction. So it will be starting here, and as I go through the pattern, I'm going to be pulling up in the direction of my thumbs, okay? And you really have to kind of look for this. It's not very easy to see, okay, but you will feel it as you try it on a lab partner. So we start here in posterior depression. Hand position is the same, and now I'm going to add traction into my resistance and pull up, pull. So again, I am pulling up on the part to give it traction. Relax, relax, relax. There we go. Okay. And pull up. Good. Okay. Traction is a nice technique. It helps improve range of motion. It also helps with patients who are having difficulty staying in the pattern. It helps with their direction of movement. So it's an excellent technique to use. Very easy to apply into anterior elevation. It's a lot harder to apply for posterior depression, so let me quickly show you that. Because now if you think about this pattern, coming down into posterior depression, in order to traction that, I'm going to have to pull the scapula away or out. Okay, so this is a little bit harder, and this is where that position that we talked about of really cupping and scooping up under that inferior border is critical for you to be able to apply that traction appropriately. Okay, so we start up in anterior elevation, I'm scooping, and go ahead and push down. And so as I'm resisting, I'm also trying to basically pull the scapula off the thoracic wall. That's your traction piece. That will be something you'll need to practice to get good at. We can apply traction or the repeated quick stretch to any of the scapula patterns. We could also apply those in our other direction of anterior depression, posterior elevation, right? So we could start down here and do posterior elevation and push up, and there's a repeated stretch. One other technique I would like to show you is called the combination of isotonics, or COI, as we abbreviate it. And basically what that is a combination of muscular contractions working in only one direction of the diagonal. So let's, since I'm standing here, we'll go ahead and look at posterior elevation of the scapula. And that we're going to isolate the posterior elevator. So let's say we're talking about trying to strengthen or improve the movement of the posterior elevators of the scapula, that movement. So what we're going to do is a combination of contractions. Now, if I'm just doing pure strengthening, I like to order my contractions like this. So I would start her at the end of the range of motion, put my hands in the normal manual contact for posterior elevation, and I'm going to start with a concentric contraction, get her to push up, and push up into me. Then I'm going to ask for an isometric or maintained isotonic contraction, hold, hold, hold. From there, I'm going to go to an eccentric contraction. She's still pushing up. I'm still pushing down. Now, let me bring your arm down slowly. Let it come down slowly. There's the eccentric contraction of those posterior elevators. Now I'm going to go to a concentric and push up into me. Push, push. Now hold it there. There's my maintained isotonic or isometric contraction. Now let me move your arm slowly down. There's an eccentric contraction. Let it come down. Let it come down. Good. Now push back up. Push, push. There's concentric. Hold it. Isometric. Hold it, and let it come down slowly. And then relax. So your patient is never stopping their contraction of the posterior elevators during this technique. Okay? Another way we can apply the combination of isotonics for neuromuscular re-education. Let's say my patient is just not recruiting the right muscles. If you remember, we were talking about overpulling of the pecs. So if your patient is just not doing the correct movement, then we can use the combination of isotonics to lock in or get the contraction of the muscles that we want. Let me stay on posterior elevation since that's where I'm standing at the moment. So we would start her down, set the scapula, start her down in anterior depression, and then we'd be coming up into posterior elevation. Well, let's say as my patient is doing that, she's just not pulling correctly. She's rotating the trunk. She doesn't seem to be activating the posterior elevator muscles effectively. So what I'm going to do with this particular patient is I'm actually going to start them at the end of the range of the motion that I'm working on, which is posterior elevation. So I'm going to come up to posterior elevation where those muscles should be activated, and I'm going to ask her now, very gently I'm going to come on, and I'm going to ask her to hold her arm here. And I'm only giving about 1 pound of pressure, very, very light resistance, until I feel that I get the posterior elevator muscles kicking in. And I'm going to build that up now. So I'm starting with an isometric contraction. And hold there. And now I'm building. And now I feel those posterior elevators. They're kicking in. They're contracting nicely. And from here now I'm going to go to the eccentric contraction. Let me bring it down just a little. I'm only going to go through a small range. Let it come down a little. Good. Now gently push back up. Push, push, push. Hold it there. So there was my concentric. Now I'm back to the isometric. Let it come down slowly. There's my eccentric, and push up. So I'm working in a very small range with the goal of training my patient to activate those posterior elevator muscles, the muscles I'm after. So I'm starting at the end range, starting with an starting with an isometric contraction to an eccentric contraction, and then back to a concentric reaction. So when I'm doing muscle re-education, patient's not kicking in the right muscles, the order of your combination of isotonics will be the isometric, eccentric, concentric. When you're just doing general strengthening and you want to use all three contractions, then I tend to start with the concentric, then to the isometric.
Okay, now we're going to look at the PNF pelvic patterns, and at the pelvis we again have two patterns, just like we had at the scapula. We have anterior elevation and posterior depression, posterior elevation, and anterior depression. We'll start by looking at anterior elevation and posterior depression pattern first. So the first thing that we're going to do is align our patient. So we have our subject laying sideline, and I've raised her shirt so that we want to make sure that we can see the spine. And when we're doing the pelvic pattern, anterior elevation and posterior depression, we want the knees to be flexed up about 80 to 90 degrees. So we're going to go ahead and bring her knees up. This will allow a little bit better movement in the pelvis. Now, what we want to look at is we do want to look at the position of the spine. We want to make sure that there isn't any rotation going on in the trunk. So we're going to keep her fairly straight here. Of course, we're going to align her at the cervical region, and she's pretty good there. But what we're going to see here is that we do have kind of a little bit of a droop. This is common in a female client because females tend to have a little smaller waist. So what we need to do is kind of bring that up a little bit. And the way that we can do that is using a towel. We're going to just fold this towel over. And then what we're going to do, let me put you right on the crank here, aren't you? Let's see if that's going to be able to come on down. Okay, and so then what we're looking for is, now you seem a little straight. Actually bend just a smidge more. Let me have you scoot up just a little bit on the table. How's that feel? All right? Okay. So we want to keep that spine as straight as possible. Okay, so we've got our patient aligned. The next thing we want to do is put ourselves in the position. For this pattern, remember our diagonal patterns are narrow. So if we think about a clock, in this position, I'm going to be thinking about that pattern coming from 11 o'clock to 5 o'clock. So we're going to start by assessing the range of motion that we have at the pelvis into anterior elevation and posterior depression. So I'm just going to go ahead and put my hand on the pelvis, on the segment, and I'm just going to have my patient relax, and I'm just going to take the pelvis up into anterior elevation and feel the end field, and then I'm going to go ahead and pull it down into posterior depression. And as we do that, what you should notice in the spine is that we're getting some side bending of the spine as we do that. Again, you want to be careful as you take the patient through the range that you're not rotating the trunk like that, okay? And we're staying in this nice 11 to 5. So up, there's anterior elevation, we have a nice springy feel, and down into posterior depression. So you can see we have some pretty good range here at the pelvis, and this is typical, especially with a female. All right, so here's rhythmic initiation. So I'm passively taking her through anterior elevation, posterior depression, and then I'm going to ask my patient to just help me a little bit. I want you to pull up and push down, and pull up and push down, and pull up and push down. Good, and relax. Okay, so if we want to go into resisting this pattern, we'll start with resisting the anterior elevation pattern. So let's talk about where our manual contacts will be. For a female, what we call a female pelvis, where we do see that the pelvis is a little bit lower, we have space between the top of the pelvis and the rib cage. What what we want to do is we want to use our manual contact on the top of the iliac crest. Now you don't want to come right on top of the bone, so the best way to approach this is to kind of slide your hand in the waist so that you have a little tissue right there on the top of the iliac crest. So I'm going to just slide here, and I'm going to go ahead and put my other hand right on top, again with our lumbrical grip. Okay? And then we're going to go ahead and pull her down into the end range of posterior depression. Again, notice that I'm going to be standing in the diagonal. And I'm in a pretty good position here, so I'm below the waist. You don't want to stand too far up here. You want to be back here so that you can use your body mechanics to do the resistance of anterior elevation. So I'm going to stand back here, facing into the diagonal. My manual contact goes on top of the iliac crest. I pull her into posterior depression, and then I ask my patient to go ahead and pull up. And I'm resisting that. So notice I can relax. I'm giving her a nice quick stretch followed by resistance through the range, and pull up. And notice what you are looking for is that nice side bending that's occurring. And pull up. What you want to avoid is hyperextension at the spine. So make sure that your eyes are looking, that she's not hyperextending at the spine. So that's anterior elevation. Very simple. Pull her into posterior depression. A little quick stretch, a little hug, lean back from your body, and pull up. Good. And relax. And pull up. Good. Keep pulling. Want it through full range. Excellent. And relax. If we want to resist in the opposite direction into posterior depression, our hand placement is very specific. It's going to be on the ischial tuberosity. So we're going to go ahead and bring our patient up into anterior elevation. We're going to go ahead and put both hands on the ischial tuberosity. And I like to use the command sit into my hand, or you can say push into my hand, and push into my hand. Good, relax. And sit into my hand. Either command, relax, and push into my hand. Good. And sit into my hand. Push, 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 push. Good. And again, notice that nice lengthening and side bend we're getting as she gets through the range for posterior depression. If we wanted to do a reversal, the technique of reversals of antagonists, we're going to then alternate between anterior elevation and posterior depression, and it will look like this. I'll start her in posterior depression, which means she'll be pulling up into anterior elevation. And pull up, and hold it there. Good. Now push down, sit down, sit down. Good. Hold it there, pull up. Good. Hold it, push down. Pull up, push down. Pull up, push down. Pull up. So you can choose to use one or two hands depending on the size of your patient and how much resistance that they need. So again, relax. So it can be pull up with two hands, push down with two hands, or again, pull up, push down. But notice if I use one hand, that we go push down, pull up, that I keep that other hand off the surface until I'm ready. You don't want to give mixed signals with that one. So that's anterior elevation and posterior depression. We could also choose to do the technique of a combination of isotonics. Let's say we chose to do that for anterior elevation. That's a combination of the three contractions: concentric, eccentric, and isometric. So why don't we look at that for anterior elevation? So you're just going to relax, okay? And we're going to have you go ahead and pull up. There's our concentric, hold, isometric. Let it come down slowly, slowly. There's our eccentric. And pull up, concentric, hold it, and let it down slowly. So we're doing a combination of isotonics, combination of eyes that need to be watching that lumbar spine as you do all of the pelvic patterns. Okay, now we've demonstrated anterior elevation and posterior depression looking at a female pelvis. I want to talk a little bit about when you are working with a more male pelvis. So the pelvis is a little bit higher, and our hand placement is going to have to change slightly. So you're going to notice with our model today that my hand fits in here very nicely, and if I ask her to pull up, I'm able to stay into this space between her iliac crest and her ribs, and you're able to resist quite easily. What you'll find with the male pelvis or with men is they have a lot more lateral musculature development, and because their pelvis is higher, it sits much closer to the ribs. So what happens, just relax, is when I say pull up, you end up popping out of that space and you're going to lose your resistance. So in that case, what you need to do is modify your hand position. So if we pretend that we had a male pelvis here, the hand placement will look like this. So what you're going to do is you're going to come a little bit more anterior. So you're going to slide your hand around closer to the ASIS. And then what you're going to do with your other hand and your forearms is you're going to hug around the pelvis. So let me go ahead and pull her down into posterior depression. So notice, instead of here, I'm going to come a little bit more anterior. I'm going to hug in with my forearms to give resistance to the whole pelvis and ask her to pull up. In this way, because your hand is more anterior, it won't get popped out on the side. You'll be able to resist a little bit more in the anterior position. Now, for posterior depression, your hand placement does not change. It stays on the ischiotuberosity for a male or a female pelvis. So the only hand that's going to change is here. So for a female pelvis, we're here, and for the male pelvis, again, coming here and hugging in. It will take you a little more practice on the male pelvis. You want to make sure that you practice on both a female and a male pelvis. Let's go ahead and work on the other diagonal pattern now, and that's going to be our posterior elevation anterior depression pattern. So if the diagonal is here, I can't be standing here, so I'm going to need to change my position. So I'm now going to come up into the diagonal. Now again, we're going to start with patient position. My patient does need the towel roll to keep her spine straight. The leg position is going to change. So what we're going to have is put the legs down just a smidge. Actually, I think what I'm going to do is, let's give you a pillow between the knees. Okay. So now I'm going to be at about a 60-degree or so angle, rather than the 80 to 90 that we saw with our other pattern, because we want to go into the direction of posterior elevation and anterior depression. Okay? So what we're going to do here is start again with our technique of rhythmic initiation. Let's just take her through the pattern and see what kind of range we have here. So again, I'm just going to grab a hold of this segment at the pelvis, have my patient relax, and I'm just going to move you through a range of motion. So that is our range of motion into anterior depression and here into posterior elevation. And again, if you look at the spine, as we do that, we're again getting some side bending. So we're getting some gapping and some compression into the spine. So you want to make sure that you know what's going on with your patient's spine. So again, you want to keep an eye on what's happening. So notice that the range of motion here is not as much as with the other pattern. Okay? So I tend to choose just somewhere where I can feel I can get a good grip onto this, on the pelvis. If we want to go into resisting the pattern, let's look at posterior elevation first. So that means we're going to start her into anterior depression. So I'm going to go ahead and push her down towards that pattern. Our hand placement, again, is going to be on the top of the iliac crest. And as we said with the other pattern, we're not going to come just get ourselves right on the bone, but we're going to scoop in here so that we have a little bit of tissue so that it's not inhibiting by being right on the bone. So I'm just going to scoop in here again with my lumbrical grip. I'm pushing her down into anterior depression. I'm again standing in the diagonal pattern. I can put one hand on top of the other, and again, I'm just going to ask my patient to push into my hands and relax. Good. And push into my hands. So there's my quick stretch followed by resistance. Push into my hands. Good. And push into my hands. And again, I'm going to look at the spine and make sure that I'm not getting any hyperextension. Now, let's talk about coming down into anterior depression. The handhold for this one is a little bit more challenging. What we're going to do is we're going to use the greater trochanter, and we're going to kind of hug it or surround it. So we're actually going to be resisting around the whole pelvis upper thigh. So if I bring her up into posterior elevation, we're going to come right around the greater trochanter, and notice how I'm hugging in with my forearms, and that's going to be the resistance as she pulls down into anterior depression. So this is where we're going. Just make sure my patient knows where we're going. So we're going to pull down or push it down. Can you help me with that? So we're going to push it down. Good. Relax. So I'm coming around, greater trochanter, hugging in, and pull down. Excellent. Relax. Pull down. Relax. Pull down. Relax. Pull down. So again, most of the resistance is coming from your arms or forearms hugging in as you resist that pattern down into posterior depression. Now, one thing we want to also talk about is what if your patient is hyperextending the spine? Remember we talked about not wanting the spine to hyperextend. Well, why might that occur? So, Shona, can you give that a whirl? Can you try to hyperextend your spine as we pull up? I won't resist you real hard. Okay, so just relax a minute. So we're going to go back to anterior elevation, posterior depression. Okay, can you pull up and kind of, good, excellent, yeah, very nice. All right, so you'll see that as I was resisting anterior elevation, my patient was going into some hyperextension. This can happen for several reasons. One could be a weakness of the abdominals, of the obliques, because it's the obliques that does this movement, or it could be a muscle re-education problem where the patient just tends to overuse their extensors for movement. So our goal is to re-teach our patient that no, I want you to use your abdominal muscles, not your back extensor muscles. So again, let's see if we can do that one more time and show that for the camera. So again, pull up and we see that she goes into some hyperextension. So the first thing that I would try would be to check my position. Am I in the right position? Are my hands? Are my body? So always look for yourself and make sure that you're correctly positioned. Then I'm going to check my leg position. Oh, well, you know what? My legs aren't bent up high enough. So we can try by bending the legs up and then going back and seeing if that solves the problem. If it solves the problem, great, you can continue. If she still is hyperextending and I feel like I'm in position, she's in position, then it must be either we've got some weak abdominals or we're overusing our back extensors. So the goal is to retrain the abdominals to fire. So the technique we want to use is the combination of isotonics. And the way we want to use that to get those abs to fire is to start with the isometric contraction. So we want to bring her to the end of the range of anterior elevation. That's the pattern she was having trouble with, was anterior elevation. So let's bring her to the end of the range. So we're in the synergistic pattern of anterior elevation. And all I'm going to do is put my hands on where I would belong, which would be resisting anterior elevation. So remember, that's on the top of the iliac crest. And I'm just going to ask the patient to hold their pelvis there. And I'm giving very, very light resistance, like 1 pound. Okay? So she's just holding there. And I'm going to feel for her abdominals to kick in. Ah, there they are. And as you feel them kick in, you're going to begin to increase your resistance in your hands so that she's firing. So now what I'm doing is teaching her to fire her abdominals and not her back extensors. If the back extensors start kicking in, you've resisted too much too quickly. Back off. So you want to build this contraction until you feel like you've got a really good contraction of the abs. Now she's understanding what muscle you want. From there, we're going to go to the eccentric. So keep it there. Now bring it, let it out just a little bit. There's your eccentric. Now pull up gently. And I usually start with a gentle. Hold it there. We're back to isometric. Let's let it out just a little. There's our eccentric. And pull up. And I'm doing a very small range. So we're training those abdominals to work in concert to do that anterior elevation. And we will continue that several times, and then you can go back to the whole pattern, and if we were to come back and say pull up, we fixed her, and she's not hyperextending anymore. So you're going to use the combination of isotonics for muscle re-education of that pattern. And we can do that for any of the patterns that we've demonstrated. I just chose anterior elevation. So your eyes need to be watching that lumbar spine as you do all of the pelvic patterns.